My name is Debbie Burke. I'm 11 years old, and I'm going into the 6th grade. I've had 107 fractures. Most of them are pretty painful. I have a fractured rib right now, and I was just sitting and it cracked.
Debbie Burke and her mother, Kathy, are among 30,000 people in the United States alone who have brittle bone disease. This disease, commonly called OI, is a painful and often misunderstood disease that causes bones to break from little or even no apparent injury. Dr. Darwin Prokop, Rutgers Medical School.
The formal name of brittle bone disease is osteogenesis imperfecta. It means imperfectly formed bones. The consequences in patients are the bones break very easily. Some patients break 10 or 15 bones in the course of a lifetime. Other patients break essentially all their bones. They break them many times over, so they can suffer 100 or more fractures. The end result is a shortening of the bones and marked deformities. Many patients are unable to walk, even with the help of braces or crutches. The spine can be markedly deformed, so the patients have difficulty breathing.
We became aware of the disease osteogenesis imperfecta through the birth of our first child. We gave birth to a beautiful little girl that we named Maureen Elizabeth. She was born with one of the most severe forms of OI, so severe that it caused her death 5 days later.
Right after Melissa was born, her feet were resting on her cheeks, and I felt like there was something wrong. When the doctors brought her back after examining her, they had a bright red tag on the top of her crib marked fragile, handle with care.
Osteogenesis imperfecta is a problem of bone disorder. It's an inherited problem. It's caused by a problem with the latticing or the collagen within the bone itself. The latticing is a soft structure within the bone that gives additional support. The problem is inherited in that it comes from families. If you can find other OI in your family, then it probably comes down as an inherited disorder like that. But many times, this is what's called a pinpoint mutation, which means out of the blue, it comes in and we see no evidence at all of it in other family members.
When my son was born, was the first that we've ever even heard of OI. As far as we know, my husband or my family has no evidence at all of OI. When baby George was born, he had so many fractures that they didn't even bother to count them. They didn't think he'd make it through the night, and he's a year old now.
During his first year of life, Georgie has had one additional fracture, a hernia operation, and pneumonia. Because he is so young, it is hard to predict how OI will affect his development.
If he's real content, maybe we'll get him to start reaching for some of the toys I brought. And then we can turn him over on his back. And you know how he's been lifting his legs real high?
Georgie's mother is working with a physical therapist to try to build up his strength.
Give him a little thrust to roll to his side.
I do hope that he walks and does everything a normal kid does, but I guess I got to be realistic, and I don't want to get my hopes up too high. But if he sits up and has better head control, he can do a lot. He doesn't necessarily have to walk to have a future.
Osteogenesis imperfecta ranges in severity from babies who do not survive birth to individuals who are so mildly affected that they have never been diagnosed as having the disease. OI is a complex disorder that involves much more than fragile bones. Short stature, skeletal deformities, deafness, dental problems caused by brittle teeth, loose ligaments, blueness in the white portion of the eyes, sensitivity to heat, a tendency to bruise easily, and problems with the heart and lungs are all complications that may be experienced. There is currently no cure for OI. Doctors can treat some of the effects of OI, but not the disease itself. As a child with OI reaches adulthood, fracturing may diminish. It is not uncommon for an adult with OI to go without breaking a bone for many years, but they may experience some of the other problems associated with the disease.
One thing that should be realized is that as all people are different, everybody with OI is different. And the specifics, even of OI itself, is going to vary from individual to individual.
Don Cheatham is 31 years old. He is the only member of his family who has OI. Although he experienced approximately 25 fractures as a child, as well as curvature of his spine, he was able to walk without crutches until he dislocated his hips at age 17.
There is much variety everywhere I've seen. California dreaming.
When I was in, I think, second grade, or just before starting second grade, I was brought into the hospital for some tests for possible operation on my back. My back had started to curve. And I never had the surgery, but I was put into a body cast and then a Milwaukee brace. And that's probably about the first time that I realized, you know, I was somehow different.
Mark Haviland is 12 years old. He is the youngest of 8 children and is also the only person with OI in his family. Mark had over 35 fractures at birth and has since suffered an additional 30. He is unable to walk, but that doesn't prevent him from getting around.
Unlike a lot of other kids with my disease or any other disease, if I was mad that I had it, then my life would be really bad. If I could walk, fine. If I couldn't, well, that's the way it is, you know.
Years ago, children with OI were often confined to bed with the hope of preventing fractures. This treatment often had the opposite effect, and more fracturing occurred because their muscles and bones became weaker. It also denied to these children many opportunities and experiences. Now children with OI are frequently active participants in the life that goes on around them.
My bones are getting stronger as I grow older, so I don't have to be as careful as I used to be. But I'm still careful, and I know, and my friends know, that what the limit is. I don't try and hurt myself, but I have to try and do new things. You gotta lean more on the back like so.
Mark is not always this active. Every year for the past 8 years, he has undergone a major surgical procedure called rodding, in which metal rods are inserted into the center of the long bones of the limbs. The procedure is often prescribed for children whose limbs have fractured many times. Dr. Lowell Luter.
The process of rodding in osteogenesis imperfecta is done to essentially straighten a curved bone. The bone becomes curved because of multiple fractures. Weight bearing causes it to bend. When this is the case, the child is unable to stand and to move or to use the upper extremities very well. It is generally done on the legs, but can be done on the arms as well.
At Shriners Children's Hospital in Minneapolis, Minnesota, surgeons are studying x-rays of Melissa Bright.
Take this and push it back down because I think it's impinging on her iliac crest.
Mm-hmm. Do you think the one on the left will need to be replaced?
At some time in the future, perhaps.
A rod in Melissa's leg has shifted because of a severe fracture and may have to be replaced. Hospitals are a familiar part of the lives of Melissa and Pat Bright. Melissa has already had 3 rodding operations, major dental surgery, and over 50 fractures.
The longest Melissa's gone without a fracture in the last 4.5 years is 11 weeks. And many times we've had both arms and at least one leg in a cast at the same time. The doctors have told me that before Melissa reaches adulthood, she'll have to have between 6 and 8 rodding surgeries for her legs and possibly her arms.
You can hold it. All done, sweetheart. There you go. Mama's going to pick you up and hold you for a while.
No one but a mother of a handicapped child could possibly know what it's like to live for 24 hours a day, 7 days a week. Having that child be 100% dependent on you.
Melissa's mother, Pat, also has brittle bone disease. She is, however, very mildly affected and in fact wasn't diagnosed as having OI until she was 10 years old. She hasn't physically experienced any problems related to the disease for many years. She has 2 older children who do not have OI and was pregnant with Melissa before she became aware that there was a possibility of her children inheriting the disease.
Mommy will be waiting for you when you get back, okay? I really get upset every time she goes in surgery, or anytime she has to go through something like this. But she's got a lot of spunk, and she's usually really happy. So I go on her feelings too. We're really close, so this is real hard. But I think that's with any special child. And I think she's real special.
Because of recurring hospitalization and recuperation from fractures, children with OI may have special educational needs. Mark Haviland attended a school for handicapped children until 4th grade when he decided to mainstream into a regular public school.
And the objective card is 6.
He is now a 6th grader at Kenny Elementary School in Minneapolis.
Crypto. Wait.
He's had to work very hard.
3 take away 2 is 9. 3 take away 2 is 1. 7 times 1 is 7, and 13 take away 7 is 6.
But he's now a well-adjusted student who is popular with his classmates and his teacher.
Thank you. Any calls for me? Okay. What line? 4. Okay.
In the evening, after he's done his homework, Mark checks in to see how his business is doing.
Hello. Mm-hmm. Joe? I think that I'm handicapped, which I am, I know that. Okay. Then it might limit more things that I can do. I don't let being handicapped hold me back because it's harder to set goals that way. Avenue East. Okay, Dallas, Texas? Yes, and what kind of insurance would you like? Car, home, and life.
In fulfilling his own goals, Don Cheatham has had to overcome many obstacles. For most of 2nd grade, he was unable to attend school and had homebound tutoring. During his late teens, he spent nearly 2 years in the hospital and at home, much of the time in traction. He began college at home through the use of a special telephone hookup to the classrooms. While still in college, he became interested in developing computer programs. After several years of writing programs on a freelance basis, he started his own business. He is now the president of Memory Bank, a company that sells computers and programming for use in business.
This would print all we used on demo.
Right.
It's a foreign to me to think that I'm doing something special or anything. I'm surviving in the best way I know how, and I guess like everybody is. And in my case, I'm interested in, admittedly, maybe more than survival. I'm trying to build a successful business, and there are a lot of things I'd like to do in the business world, financially, and so forth.
Don leads a very active, full life. In his leisure time, he's a prolific songwriter and musician. And whenever he gets the chance, he likes to pursue his newest hobby.
I haven't had to battle OI in years, but I battle misconceptions and myths that people tend to have generally, I suppose, towards someone like myself that has an apparent handicap or disability.
Melissa was lucky this time. The rod in her leg did not have to be replaced. The doctors were able to reposition the rod through a small incision near her hip. In a couple of weeks, Melissa will have recovered from the surgery and will once more be active. However, within a year, she will have to undergo surgery again.
How long do you
The rods in her legs will have to be replaced as she outgrows them.
What's the day?
For Melissa and thousands of children like her, the pain and suffering caused by OI is a fact of life. There is presently no effective treatment, no means of carrier detection, and no biochemical test for diagnosis of osteogenesis imperfecta. But recent developments in research are giving hope that soon the disease will be conquered.
For many years, I've been doing research on collagen, the major protein in bone. More recently, I and my colleagues have been working on brittle bone disease. Until a few years ago, it seemed impossible to solve the problem of brittle bone disease. That's all changed. It has changed because of research at two levels, one at the level of proteins and one at the level of genes. We now know in great detail exactly the structure of collagen, the major protein found in bone. The essential information which to think about what could go wrong in brittle bone disease. The second development has been the area of understanding genes. In particular, the new techniques of recombinant DNA or gene splicing. These techniques give us the tools to look at genes, any gene, in great detail. And now we're in the very happy position of being able to bring together these two lines of information. In fact, at this stage in our studies, it seems like brittle bone disease is one of the most important projects for us to undertake and to solve. In my own laboratory, we're particularly concerned with developing a new test for brittle bone disease. We hope shortly to be able to have a test in which we take a sample of blood like this from a patient with brittle bone disease or a member of his family and tell exactly who carries the defect for this disease. That's the first step in the more complete understanding of this disease. It's a very necessary step, of course, if we want to go on to the next stage, that is developing an effective treatment for the disease. We're at any rate at a point where the next phases of research are going to be very exciting and very helpful to everyone involved.
Imperfecta Foundation is a national nonprofit health organization that is building a network of communication and cooperation among families affected by OI, physicians, and research scientists. The OIF is funding research, providing public and professional education, and sharing hope and information. This work is supported by contributions from concerned individuals and organizations. Please join us in working toward our goal that someday there will be a cure so that the thousands of people who have OI can be helped.